So when your patient has an epidural that includes local anesthetic, you'll do a Q4-hour dermatome assessment. To do that, you will get a glove full of ice or alcohol swabs. And then I will start by putting the ice on my patient's face. And so this is full sensation and this is your cold. So I would first go to T4, right above the nipple line. Is this the same cold as your cheek?
Yeah, that feels the same.
How about this side?
Yep, still feels very cold.
So when it's the same, that would be full sensation. Next, I would go to T4, just below the nipple line. Is that the same as your cheek?
Yes.
Is this side the same as your cheek?
Yes.
Okay. Now I'll move down to T8, the lower ribs. Is that the same as your cheek?
Yep.
Is this the same as your cheek?
I think so.
Okay. So this is the full sensation. Is that the same as your cheek?
Yes.
Next, I would move to the level of the umbilicus at T10. Is this the same as your cheek?
Yes.
Is this the same as your cheek?
No, that feels a little bit less cold.
So I would mark that as diminished on the right side at T10. Next, I would go down to L1, which is at the pelvis line. Is this the same as your cheek?
No, that feels a little less too.
So that would also be diminished on the right at L1. Is this the same as your cheek?
No, that feels the same as the other side. It's still a little bit diminished.
Okay, so that one would be documented as diminished as well. I would then go to L3 on the legs. Is this the same cold as your cheek?
I don't feel anything.
Okay, that would be documented as an absent sensation. How about over here? Is that the same as your cheek?
I don't feel anything over there either.
So bilateral absent sensation for L3.